the lack of movement of all this mucus and infection, that's when surgery comes in to enlarge these drainage ports so that you can get rid of the infection.
Wonderful. Thanks for that call, Rocky. All right, so Dr. Hickham, now with you. So obviously sinus, another big problem in our community people suffer with. What is sinus and what causes the sinusitis?
Well, sinus is an infection of these various sinuses that I'm pointing out to you here. And what causes it? It could be an immune problem, as David mentioned. It could be allergies that cause these little drainage ports or ostia to close. And it's just the lack of drainage, the stasis or stagnation of the mucus that offers, as I mentioned earlier, a good medium for the bacteria to grow.
Okay, and so what are some of the symptoms of sinusitis or a sinus infection?
Yeah, well, it's, inability to breathe through the nose, obviously. Discolored discharge, pressure in the front of the face. I mentioned inability to smell. A lot of times people just don't feel well. It takes a toll. Actually, I've seen studies where in chronic disease, sinusitis actually is more debilitating than something, for example, like rheumatoid arthritis.
Okay, and so if someone has been experiencing a headache, and a lot of us have headaches, and we don't really know it's our sinuses. A lot of us will just take Advil or just think, oh, I have a tension headache. How does one distinguish the difference between a headache that's being caused by another reason versus sinusitis?
It can be tough. A lot of times if you're having a migraine type headache, it will often be associated with an aura, visual disturbances, nausea, sensitivity to light. And people who have had those generally know about it. In females, it starts at about age 11, boys age 5. If you have never had that and all of a sudden you start with this pressure, with the nasal congestion, discolored discharge, postnasal drip, then it's pretty easy to distinguish the two.
Okay, and so what about the treatment options? So if someone, first of all, who's had these recurring symptoms, before we actually talk about the treatment options, I want to talk about, the risk factors of it not being treated. I mean, some people are just going to live with the symptoms the way they live with symptoms, of allergies. So talk to me about that, doctor.
Well, the risk factors are just having a poor quality of life. That is the main one. There are certain infections that can be very aggressive. Those can get past the bony confines of the sinus and actually spread into the soft tissues of the face, the eye, even the brain. That is very rare. Okay. The main thing is just the fatigue and quality of life.
Okay, so let's talk about the treatment options for sinusitis. Medication, for instance. Some over-the-counter medication. What do you recommend, doctor?
Well, a lot of it is, as David mentioned, attacking allergies, since there is a close relationship between the two. Then antibiotics, because unlike the common cold, bacteria can be treated with antibiotics. You want to decrease the swelling in the nose. I mentioned decongestants, antihistamines, environmental precautions that he had gone through, but really it's antibiotics.
Antibiotics. Okay, we have a caller for you. We have Colleen on the line. Good evening. How are you?
I'm fine, thank you.
Your question tonight?
All right. I was recently diagnosed with mastocytosis. I hear it's a fairly new disease. There's very little you find online about it. And I don't have systemic. I have it up the GI tract, and I have double the mast cells in my system. And they don't know what provokes it, but it's idiopathic when I'm in a reaction with it. And what happens is I have twice as many histamines, so they react. So basically I go into anaphylactic shock. And I'm just wanting to know more about it. I don't know much about it, prognosis, anything like that.
Okay. Doctor, who would like to answer that question?
Mastocytosis is an abnormal accumulation of mast cells. It sounds like it's in your gastrointestinal tract primarily, and I'm glad it's not systemic mastocytosis, because that's typically the variation of it that is associated with the anaphylactic reactions. Typically, the people who have it in the GI tract are going to have GI symptoms primarily, and you're thinking diarrhea is the primary one. So the treatment options are really hard to say over the phone without knowing more about your case, but but antihistamines might be a mainstay of a therapy to block the histamine being released by the mast cells, and there may be some more aggressive treatment needed depending on what your oncologist perhaps is involved, or your GI specialist found on the biopsy report.
Thanks for that call, Colleen. Great question. Very interesting question. So, doctor, back to you. So now you discussed antibiotics. So how many times can someone actually be prescribed antibiotics before you have to look into maybe the next step, other treatment options?
The general rule that we go by are, if you have a sinusitis that is recurring or just won't go away, David mentioned 12 weeks of chronic sinusitis symptoms being a good time frame. But if you've been treated 4 to 6 times in 1 year, that's probably too much, and maybe you need to start thinking about getting a little more aggressive.
Okay.
Recurrent infections often are immune problems. Chronic infections are often the wrong antibiotic, or there's an obstruction.
Okay. So the difference between acute sinusitis and chronic, what's the time difference? Recurrent.
Yeah.
Well, the 12 weeks is what we go by for chronic sinusitis.
Okay.
And once you get to, at least our academy kind of espouses this definition, once you get to 4 to 6 infections per year requiring antibiotics, even if you pretty much clear up, then we kind of throw that to either in what you want to call recurrent acute sinusitis, or some people just call it chronic sinusitis as well.
Okay, wonderful. All right, so let's go. I know that there's a lot out there, new technology in ENT field, and especially to relieve sinus pain and pressure for patients. So there's an in-office procedure, doctor, balloon sinuplasty. Tell me about that. What is it, and how does it work?
All right, we kind of borrowed this from the cardiologist, and probably the audience would be more familiar with how a balloon works to open up clogged arteries. It's a very similar concept. When I mentioned ostia, or the drainage sites for these sinuses earlier, those are the sites where all the problem, that's the site where we want to go at to kind of help with the problem. We put the balloon in just like you would with a blood vessel. We open it, it pushes the bone aside. And the nice thing with this technology is we're not removing tissue. Scarring's not an issue. We're remodeling the bone so it lasts. And it can be done in the office with minimal time off missed in work. Sometimes is less than 1 day, as little as 1 day.
Okay, so what do you have there, doctor, to show us?
Yeah, they have different types of balloons to perform this, and we do it in the OR as well. But for the correct patient, we do it in the office. And after just putting some numbing medicine in the nose, we guide the tip of this instrument into the ostia, and I hope you could see it, but you just inflate it.
Wow.
It's 10 atmospheres of pressure, it's 6 millimeters, and it just enlarges that ostia. It doesn't have to be that big to take care of the sinus disease. So you figure you're doing it in, the sinuses on one side may take you 5 minutes, and maybe 20 minutes on the other. Just depends on how quickly you can find your entrance.
Okay, and so this balloon sinuplasty, is this a permanent solution, or does someone have to get this maybe a few times in their lifetime? How does that work?
Well, if you have seen someone like Dr. Schneider, and he's got the allergies under control, your immune system's good, it should last indefinitely because we're actually remodeling the bone. Again, I did mention we're not taking out tissue, which makes it very safe.
Okay.
But you're opening it up by pushing the bone aside, and that bone does not regrow. It just stays where it has been placed after you inflate this balloon.
Okay, and then, and so this procedure, it's done in the office. Can people go back to work the next day?
Some people do go back to work the next day. I usually tell people to take, obviously, the day we do the procedure and the next day off. It varies, though.
Okay. There's actually a question that came through via Facebook, our wonderful social media followers, and because we're talking about balloon sinuplasty, this one gentleman said, "Dear doctor, I've been using nasal spray for about 10, I use nasal spray about 10 times per day for his sinus issues, and he feels like it's just no longer effective." And I know there's a lot of you watching tonight who do the Afrin and everything else out there. When is it time to maybe move on to another option, doctor?
Yeah, I'm afraid to ever recommend the use of over-the-counter nasal sprays for this very reason. What they do is, well, first of all, the nose is a very vascular organ, lots of blood vessels. It causes these blood vessels to constrict, altering blood flow, increases inflammation. Initially, you put it in your nose, you can breathe great because you have so much room as these blood vessels constrict. After you do damage to the lining of the nose and you get rebound inflammation or dilatation of these blood vessels, you're using it more and more often, causing more and more damage, and you get into a very, very bad cycle that's not going to be beneficial to you at all. It's actually going to really cause you to be congested until you get off of it and try something else.
Okay. And another question that come through, doctor, again with sinus, is what can I do about my snoring? It's very hard to sleep with this nasal blockage.
Yeah.
Is there a correlation between sinus infections and snoring?
Well, you know, there is a connection, and oddly enough, it is a kind of a loose connection. There are some people you can open up their nose, they breathe great, they still snore. Has to do with the anatomy in the back of the throat. Most snoring comes from the soft palate, which is the roof of your mouth, and the uvula that hangs down the back of the throat. Frequently, if you can get the nose open, you can improve it, but that's not the best way to go after snoring.
Okay. And now with this balloon sinuplasty, doctor, who's the right candidate, and who should not have balloon sinuplasty?
Well, anybody who's had an infection that just won't clear, has been treated appropriately with the medicines that Dr. Schneider has outlined, is a good candidate. It's been 12 weeks, or as I had mentioned earlier, 4 to 6 infections in a 12-month period. You don't want to just keep taking antibiotics.
Okay. And now what about surgical options?
Well, if they're not a candidate for the in-office procedure, which obviously I think most people would recommend, they may have a little more extensive disease like the gentleman that called earlier with nasal polyps. This procedure is not indicated for nasal polyps. That's something they need to go to the operating room, and you need to remove tissue or those polyps.
Okay.
And so a more aggressive procedure done in the operating room where you're actually removing tissue.
Okay. And with this, with the balloon sinuplasty, doctor, are there any risks associated with that, or any downtime?
Well, you know, about 24 to 36 hours of downtime. You do not get scarring.
Okay.
You know, risks you may have, generally people will have a little pressure or headache for maybe a day, day and a half.
Okay.
And maybe a little bit of oozing of blood for a day, day and a half, but
Okay.
those are the main ones.
So basically, to sum it up, Dr. Hickham, balloon sinuplasty, there's obviously options for people who do suffer with recurring sinus infections. Obviously, see an allergist if you have allergies, and if it's chronic, it's a wonderful procedure. It's pretty painless in office,
Right.
and your patients have been very happy with it.
Absolutely. I'm very excited about the way we've kind of advanced sinus surgery over the past few years. 2005 is when this technology came out. We started only doing it in the operating room, but over the past 2 to 3 years, it's been a real breakthrough to be able to do in the office.
I think that's wonderful. And doctor, because we're going to be wrapping up real soon, a few questions that come in for you, Dr. Schneider, via Facebook. One of them was, if someone is using a nasal steroid spray such as Nasonex or Flonase, is it okay or even desirable to use an oral antihistamine such as Zyrtec or Claritin?
Well, studies have shown that those are not as effective as you might think. If nasal steroids are already in place and you use an oral antihistamine with it, and we do a research study and we put a placebo there, the patients and the people observing the study can't tell who got the real antihistamine, who got the placebo. So you know, there's not much you add to treating allergies with when you have a nasal steroid already on board.
Okay. And doctor, if someone has allergies and really has never seen a doctor or has not been prescribed any medication, can that lead to asthma or other respiratory illnesses in the future?
Well, certainly there's a concept called the allergic march.
Okay.
It's in kids where the infants come in with eczema. You know, little babies that have very rough, dry, red skin, their immune system can then march into different places. The reaction can go from the skin and then maybe go into the lungs. And from the lungs, there may be even in the middle of that some food allergies that develop. So the gut would be involved. So you have the skin and then the gut and then the lungs. And then we have allergies develop into the nasal passages as well. There's been some research to show that if we can try to stop the eczema early on, then perhaps those lymphocytes or white blood cells involved in the process don't home back into the lungs at all. and so we can maybe modify the disease process.
And again, it's all about being proactive and doing research. And the wonderful thing about medicine and why we love this show is that there's always, wonderful doctors in the community who can actually help patients. When it comes to sinus sufferers, you don't need to suffer. If you have allergies, talk to Dr. Schneider. He could take care of you. Thank you so much for being here tonight. I really appreciate it. The time really flies by on this show. Thank you, Dr. Hickham. All right, so for those of you who want to receive more information or you want to contact firstly Dr. Hickham's office, you may call 504-889-5335 or visit his website, meterysinus.com. And for Dr. Schneider, you can call 889-0550 or visit yourallergydoctor.com. Love that domain name. I'm Maria Muro, and I want to thank you tonight for tuning into Doctors New Orleans. Remember, if it's about health, we cover it, and we've enjoyed hearing from you. Thank you for your calls tonight. We hope you found this show informative, educational, and inspirational. Stay healthy, and good night.
Doctors New Orleans is underwritten by Acadian Ambulance Service and New Orleans Living Magazine.
It's time to get covered, Louisiana. And Blue Cross has a plan in every parish, every zip code.
No matter where you are, you're covered through and through. We got a Blue for you.
I'm covered.
From Lake Charles, North Round, Shangri-La.
Covered.
From Venice to Vidalia, back over to
I'm covered.
No matter where you are, you're covered through and through. We got a Blue for you.
Call your Blue Cross agent or go to bcbsla.com and get covered too.